Good evening, everyone, and welcome to tonight's webinar, Hype or Reality, the Actual Impact of AI in Dentistry. My name is Linda K. Tyler, and I am the Director of Business Development for ASDA. I am pleased to welcome the Association of Dental Support Organizations as a sponsor of this program. We have an informative and interactive presentation planned for you this evening. During the session, you will hear from two speakers who will discuss the application of AI in clinical practice, how to incorporate AI into patient diagnosis and care, and the past, present, and future applications of AI. During the presentation, you will have an opportunity to answer questions, and we will also allow for questions at the end of the presentation. At this time, I would like to welcome Lisa Ward. She is the Vice President, Communications and Strategic Initiative for ADSO. And Lisa will introduce our speakers who will be joining us for this webinar and serve as the moderator. Again, we will allow time for questions throughout the presentation as well as at the end. Please join me in welcoming Lisa. Lisa?
Hi, everybody. Good evening. Thanks for joining us. With AI in the news everywhere and its applications nearly unending, we wanted to talk to you, dental students, about AI in the dental practice, its practical applications, and maybe even its future uses. So I am thrilled to welcome two people who will be discussing AI, and I will warn you at the outset, they are good friends. So they are going to be engaged in a lively discussion, and I think a really good one. First of all, Dr. Seth Gibbrey, he is Senior Director of Clinical AI and Innovation from Heartland Dental. I'm sure that many of you, if not all, have heard of Heartland Dental. They're the nation's largest dental support organization, and they have support over 2,800 doctors in 1,700 locations across more than 38 states, which is impressive. We also have founder and CEO Dr. Florian Hillen from Vidya Health. Vidya Health brings AI to the dental chair and uses AI to help clinicians provide better care, build patient relationships, and even drive financial performance. And so with that, I am going to start out because we want to make the most of our time together. And I am going to ask Florian first, basically, what is artificial intelligence as it relates to dental? But more importantly, what does it look like in a dental practice?
All right. First of all, thank you so much for the kind introduction, Lisa. Great to see you, Dr. Gibbrey. And thank you, everyone, for joining. Please do me the favor and just ask as many questions as you can. Again, there should be really learning, and it's much easier to understand where you are on your level of AI. Lisa, to answer your question, maybe first of all, what is AI? And I don't want to make it super lengthy, but prior to founding Vidya Health, I was in total now 10 years in AI or machine learning in different domains, actually. And I want to give everyone a concept what AI actually is, because throughout the news right now, it's a little bit muffled. So AI is not really a defined term. The high level, what you can imagine is there's an input, then there's the AI system in between, and then there's an output. And the more data you have, the better algorithms you build, the better you train the system, the better, depending on the input, the output is. And so let me give you examples what I mean by that, because now there are different types of AI. The first one we would call search or ranking AI. And you all are using this probably every day, and that is Google. Google, for instance, your input is your search words, and then the AI is in between, where it ranks according to your search firms which websites you show, and the output is then which websites or what answers you have. And now you can see that's why Google is so dominant. It had so much data that if you go on Google, you had much better output than on Yahoo, for instance, right? It's a good example. That's the one type of AI. The second type of AI is what we call natural language processing. It's a type of machine learning. And I bet most of you have used that as well or are using it, because that is either your Alexa, the input is, hey, Alexa, what is the weather like today? The AI is then trained on even my accent, even Seth's accent, all of our different words and so on. And then the output is, hey, the weather is this much degrees, etc. Right? And another form of natural language processing is words, but it's also written. And so ChatGPT, to be quite honest, is nothing else than a more complex, or like to some extent the perfection of natural language processing as we know it right now, right? You write something into ChatGPT, it comes back and has an output. And then the last form of AI is computer vision, right? So with image data. And that's, for instance, how a Tesla navigates and identifies a stop sign. And the input is like, there's a stop sign, the AI system has learned, trigger, brakes, and then the output is that the car stops. So those are the three buckets of AI. And I hope I'm not too lengthy, but I just want to put some structure in it, right? Exactly, Seth, you shut me down if I'm too long. So this is how we think about AI. Now,
keep building your AI umbrella. It's good. Keep going.
Thank you. And then now we go into dentistry and what are the applications? And quite honestly, every AI applies in dentistry. Now, what we are doing specifically in a prioritized way together with Dr. Gibri and Heartland Dental and in fact, at this point, with over 30,000 dental clinicians and over 15 million patients, is computer vision AI. So what we do is we take X-rays, which all of you have learned how to read, right? Bite wings, PAs, Panos, you name it. And that's the input. And our system has learned now on almost 500 million dental X-rays. And we had over 100 dentists training the AI. So our AI is trained on, to put it in simple terms, on 50 times as much data as any given dentist would ever see in their lifetime, right? And trained on 100 experts. And then the output is the X-ray, but this time we surround or we highlight potential caries disease, right? Or cavities, periodontal disease like bone loss, calculus, endodontic, which is like periapical radiolucent lesions, infections of the root tips, right? So that is what we currently do. That said, there are tons of other AIs, such as natural language processing, if you think about patient engagement, right? And by the way, this will all change, and we come to this later, Lisa, right? But patient engagement will change, right? And even ranking, helping you to identify which are the best treatment codes and so on. So all types of AI will apply. But what we currently do and what we will focus on today is the computer vision AI, right? And so Seth will talk more about it, right? But bottom line is that we have algorithms to identify disease. And these algorithms have to go to rigorous clinical studies with the FDA because we have to show, that they are effective clinically. And the high level, and I think Seth will talk more about it, is that the AI together with the clinician, can catch disease earlier, doesn't miss anything, but most importantly also is a great communication tool to the patient. But I think I pause here, and I think this gives a good overview.
So if I'm understanding you, the artificial intelligence actually learns the more it's used, the more inputs it gets, the more accurate it can be.
Yeah, that's an absolute true statement.
Okay.
I think it's, under the hood a little bit more complex, but I think what you could say is the more data we have, the better, because the more fair the AI gets as well. And that's an important point.
Okay.
Like the more accurate the AI is also for children, for people of different backgrounds and so on. So I think that's important. And then the more dentists it trains is important, and the bigger the feedback loop is. And by feedback loop, and I bet everyone here has used ChatGPT, sometimes it gives you an answer and it gives you two answers and it says, which one do you like, right? We do the same thing in our software. We give you the cavities, and if the doctors trigger, hey, this cavity I don't agree with, we actually capture all of that, and then we can improve our AI based on that feedback.
Yeah. And so that's a perfect bridge to Dr. Gibri. When you're using AI in dentistry, and I know that you're the champion here and know a lot about it, what steps do you take to ensure that the AI is accurate?
Thanks, Lisa, for having us, and it's a pleasure to be on here with Florian, and I'm glad everybody's taking some time out of their night to join us. I think Florian said some great things that I'll kind of highlight on. Is one, you do have a regulatory process, so it's important to understand that there is a governing body, the FDA, that looks through to make sure things are accurate, the models are trained correctly, that there's a certain threshold of clinical ability that the AI has to surpass. So it's got to be better than basically a dental radiologist. So what you want to see is you want to see a dentist by themselves really is not as accurate as the AI, but really where it comes in, and Florian was talking about this, is that it's really not the clinician versus the AI, it's the clinician versus the clinician with AI. So it's like, for me, it's like using a set of loops. So if I'm doing a prep on number 19, and before I had loops, I could see it at a certain level. Well, I add loops, and okay, maybe I start with a 2.5 magnification, and then I go to 3.5 magnification. And my magnification keeps getting higher. I see more and more and more. And so it's kind of like the same thing with AI, is it helps almost act as loops for your x-rays. So it highlights items for you. But again, I think one of the things that Florian also highlighted that was super important is that the clinicians maintain autonomy. So this is a findings tool. It's highlighting things for you. But I think as our careers go longer and the more we see, then the better we get at being able to diagnose. So when I was early in my career, my experience level, or my patient interaction level, was less than it is 20 years into dentistry. And so now that I'm almost 25 years, actually more than 25 years into patient care now, and geez, that's just a whole different thought process that just hit me.
You started with 12, Seth. Don't worry.
Yeah, something like that.
The Doogie Howser of dentistry.
It's funny. Yeah, they don't even know who Doogie Howser is.
I know. As soon as the words came out of my mouth. Yeah.
I just think back of all the patients that I've seen over the years, and those patients, each one is an experience, and each one is toward the 10,000 hours of mastery to become a master in something of what we do. Well, with AI, you have the ability to train a model so fast that it's so accurate as it is, but then the more information and data it gets, the more and more accurate it gets. And so to Florian's point is, yes, initially that data subset is trained by highly skilled clinicians, dental radiologists, experts in the dental field to identify pathology or caries or what would be findings, bone loss, those kind of things. And so that's a super critical component about training an AI model or training a machine learning model, is because it's important on what that's trained in on the front end, so that what the AI is producing on the back end is accurate. And we see that in the news with some of the AI models that are out there, that they're being pulled from use for inaccurate things because of the data subset that the models were trained in on the front end. And so that's where, like, within this space, it's super critical that the regulatory aspect comes into play, and it's super vigorous to make sure that there is a level of accuracy. But then also it does go back to the point, this is a finding tool, and clinicians always maintain the autonomy. We all know patients are way more than just a set of x-rays. There's a lot that goes into somebody, what their occlusion is, what their health history is. And I think as we see, and I'm happy Florian was talking about language models and different forms of AI, because I think from an innovative standpoint, we see a lot of opportunity for improvement in the workflow of a practice. And ultimately, it goes back to, how do we support doctors to really become better at helping their patients? So take some of the stress that's off of them, or it's hard when you're going from concentrating on doing a root canal on number 3 and looking for MB2, and then you have to go do a hygiene check and look at a set of x-rays, and maybe your eyes are tired, or you've been so focused on one thing for so long that you want to make sure everybody's got your best. And so AI will help create efficiencies in the workflow so that we can be better for our patients. And then ultimately, it's how do we deliver a higher level of care to patients? And I think AI is going to really help on that too. But it's super critical, and we've been involved really since day one in this space. I've been working on it for 6 years plus now. Somebody was reminding me the other day, I think it was 7 years in February, but it's just amazing how it's grown. Yeah, it's kind of crazy. Florian's like, I was at MIT 7 years ago.
Yeah.
Florian and I met, I guess, almost 6 years ago now, and it's been great to really be partners with him and others in this space to help create solutions that are going to help patients worldwide. And so that's what I think is is super
Yeah.
cool about it. I know that was a long-winded answer to a regulatory question, but I think it's critical that there's some context associated with that too.
Steph,
Well, I
can
didn't. Yeah,
sorry, Lisa, do you mind if I quickly jump in?
not a bit.
Um, so
He's been
also,
wanting to jump in for about 2 minutes. I've watched him. He's ready.
I was looking for a break, Seth. No, but so we actually on our company Video Health, we also have a in Harvard Business School case study, and I don't know if any of you are familiar with, but at some point you probably decided, do I want to study anything in dentistry or do I want to do an MBA or whatnot? And so so I'm every month I'm teaching at HBS about AI, not just dental AI in general, and I think I want to use this opportunity to explain one concept, what you just mentioned, Seth, which is like the dentist versus, so to say, the dentist with the AI, and that improves clinical outcomes. And we all can think about, the error rate of a human or of the AI, of ChatGPT or even of Alexa in kind of two dimensions. And one we call false positives and one we call false negatives. And I do want to use the opportunity to just like teach that a little bit. So a false negative would mean, and I stay with dentistry, Seth, right? A false negative, you have a bite wing. And let's say you as a dentist say, oh, wow, there are these 2 carious lesions, but maybe there's a third one and you didn't see that third one, which is fine because, you're tired, there's little time, you didn't do all the change in contrast, or the image quality is just very poor and it looks like cervical burnout, for instance, right? Then this one is a false negative, so to say. So you've missed that one, right? And a false positive is that if you think there's a decay, but then you actually look at the mouth or whatnot, and you realize like, oh wait, that was actually an image artifact and it wasn't decay. That's a false positive, right? You wrongly said that's positive. So those are the 2 dimensions. And by the way, this is how you can measure any aspect of AI, even at Tesla. If it doesn't stop at a stoplight, it's a false positive. If it missed it though, because it assessed it something else, yes, you can map it across everything. Now, what we actually try to achieve is, and that's what we measure, we try to achieve that the AI together with the dentist, that the false negative rate, first and foremost, goes down so that you miss less disease. And that's really important. And for instance, in our FDA studies, we showed that we reduced the false negatives, so the missed potential carious lesions, by 31%. So we identified, so to say, 31% more true decay, right? And at the same time, we also try to not increase the false positive, so to say. But that is why we do it, because the dentist should see all the highlights, and then you have the best experience and also expertise to then, after you have all the highlights, to then know the patient, have much more information than just a radiograph, right? And then make actually the treatment plan based on that. And you keep the full autonomy. But I kind of wanted to explain these 2 concepts.
Well, and I think that's actually, that kind of plugs in with one of the questions in the chat that we had. So Kevin Kim asked, out of curiosity, what are the possible setbacks of using AI in clinical dentistry? What happens if misdiagnosis malpractice occurs from wrong information provided by the AI, and how can we prevent this from happening or protect ourselves as clinicians while using this new technology? And I think that's a great question about how AI is going to be used in clinical dentistry. And I think that's so critical at what I was talking about before, Florian was just hitting on, is the aspect of it's the clinician plus the AI. You still have complete autonomy. So it is at a diagnostic standard so that it's over that benchmark. But again, you as the clinician have the final say. And so I think that's important to remember, because there's always misdiagnosis. I think it actually helps from a lawsuit standpoint, a malpractice standpoint, because a lot of lawsuits revolve around supervised neglect. So where you're having somebody come in that's got periodontal disease that is not being identified or not being treated, or you've got a patient coming in that has a periapical lesion that's blown out tooth, and just in the rush of your day, you miss it. And so having that support mechanism kind of underneath your clinical skills is a super critical component to have. And we also know AI is being used by insurance payers or insurance companies as part of their claims processing to make that process smoother. So we know it's something here. And so that's why I've spent so much time the last few years is really helping to make sure that it does go back to the provider. It does go back to autonomy. And then the second question that we have in here, Florian, I want you to take, especially with your radiology background. It's do you think with AI, which is taking more of the brain work, specialties such as radiology, pathology, orthodontics will be less popular as AI can come up with a diagnosis or treatment plan, which makes the job easier for general dentists? And then I also want to tweak that a little bit and ask, do you think that, and I know radiology went through this when AI came into radiology to begin with, that they were kind of threatened by the technology, and then they've come to embrace it because it's an additive technology, that they're more accurate with their diagnosis, they're missing less things. So do you think specialties will become less popular because of AI? I know what I think, but I'm curious to hear what you think.
I'm also curious what you think.
Okay, so you want to throw it back to me, or just you got to go first? You go.
I can go first. But radiology and pathology, as it pertains to dentists or in healthcare, how should I interpret this?
I mean,
That's a good question for Nishua, right?
Yeah.
I mean, I think let me make this following statement. First of all, in general healthcare, and then I go into dentistry. In dentistry in general. All right. I do want to actually use the analogy though in healthcare. 10 years ago, the New York Times published an article about in 2020, we don't have radiologists anymore, the AI radiologists. And everyone thought that radiologists would be out of the job and all of that, because honestly, what we are doing right now has been done 10 years ago already in healthcare. And last time I checked, there are more graduates now of radiologists. Their payment went up by 30%, and they're desperately needed. I think what's going to happen is what happened in radiology, at least, that imaging methods became much more sophisticated. You do now much more MRIs, etc. With the imaging, also identifying disease became much more complex, right? Because all of a sudden you can go into much more shades of gray and all of that. So before this company, I worked in breast cancer and chest X-rays, and so I spent some time there. And so with the increasing complexity, you actually need both. You need the AI to help to dig through the complexity, and then you nonetheless needed a human expert, to synthesize all of that information together. And so that's actually this assisting tool. And I'm very confident that we will see the exact same thing, or we are seeing it already in dentistry. So I do believe that maybe some procedures are going a little bit more from the specialist to the GP, but that's not limited by, I believe, the diagnostic performance or anything. I think that's like a lot of like procedural training and all of that. And that's what I'm curious about what you think, Seth. But bottom line is I don't actually think it will change that much in your profession, in the sense that I do believe you will spend a little bit less time in 5 years in the diagnosis and treatment planning, but and in the administrative tasks, so to say, in the documentation, in spending time in the back office, right, writing clinical notes to claims insurances and so on. And on the opposite, you will, I think, spend more time with the clinician doing procedures, etc. But we have not seen one impact, actually, quite the opposite in healthcare at this point. Steph, I pass it to you, and then I can take Jeffrey's as well.
No, ultimately, I believe we're in a relationship business. And so for me, anything that can help create more time that I can spend with my patients is a win. And so
right.
I think about going to my doctor and how she runs around just crazy. Like she's got so much going on, so many things happening, and I'm talking my primary care doctor. And she tries to spend time with patients, but there's just so much going on. Same thing in dentistry is there's a lot to a day that goes into, okay, diagnosis, but it also patients. You can have the perfect diagnosis. You can be 100% right or on what you're diagnosing for a patient. But if they don't believe you, like you, and trust you, and they don't move forward with the care, then what does it matter if your diagnosis is accurate or not? Now, 100%, you need to be like clinically on your game. But people know, were you nice to them? Did you hurt them? How did you make them feel? So I think those things are important. They don't know that you're like, they don't know that my crown margins were perfect. They don't know that every time I did a composite on number 15, I thought about it being on a big screen in front of a room of 3,000 dentists and wanting them to go, wow, who did that? Like, I approached every procedure as, no matter who the patient was, what they were capable of, I'm giving them my best. And I think AI helps in that because I can spend more time patient facing. And also, it's a challenging workplace right now because competition for team members and jobs is changed over the last few years. And so COVID, it changed at COVID. I mean, so I was around pre-COVID, and I'm still here after, and the marketplace has changed in regards to team members and hygienists and dental assistants and business assistants and practices. And so AI having the efficiency to help with that is super important for the landscape of healthcare, not just dentistry. And so I think that's something to keep in mind. I don't think that AI is going to create a situation where we see people less into specialties than prior. I think orthodontists, you would see more threats from like clear aligner companies. That was always a fear back in the day. Oh my gosh, general dentists are going to do clear aligner therapy and take away all the orthodontics. And we just haven't seen that happen. And so I think from a specialist standpoint, there's always going to be a need for them. There's always going to be a marketplace for that. And so I think that'll always continue. So hopefully that helps answer your question.
And I know there's another question in the chat, but just talking about adopting AI, and I know that Vidya Health and Heartland have been partners now for a little bit. As you introduce AI into Heartland, did you encounter some concern or reluctance or even pushback from some of your clinicians? Did they feel threatened?
So let's say that we have 2,800 supported doctors, and we have really 5,000 hygienists. So almost 8,000 clinicians that are supported by us. I don't know if you've been in a room with 20 doctors at one time. It's hard to get us to agree on much of anything. And so I kind of always joked with my patients is if you go to 10 different doctors, you're going to get at least 10 different opinions on what somebody needs to do, because we all have different diagnostic experience and belief windows based on training, based on life, based on our experiences, our practice level, all those kind of things. And so, yes, that was super important to us, is that we really sought clinician feedback and continue to do it each and every day. And I think if you don't continue to strive to be better and you become complacent, then we're doing a disservice to those we claim to serve. And so if you, I wake up every day trying to figure out how to make dentistry better for clinicians and for patients. Like literally that's what I do. And that's what I've been doing for the last 6-7 years is, okay, how do we find innovation and other things that really help move the needle forward? And sometimes, like I said, working on this, especially this specific case for 5 years, there's a lot of work that goes on behind the scenes. Then all of a sudden you have these news articles, or you have these press announcements, or you have these social media blasts, and things are in the news. But those things, the ground game has been fought for so long. And for me, it is so important to hear from clinicians, to hear what they want, what they need, what they don't like, challenges they're having, how you can make things more efficient and effective. And so, and I think that was important with our relationship with Vidya Health, is that just finding partners that would work and that are willing to listen to clinicians. And I know there's a question in the chat here that I'll take and then pass it on to Florian. And it says, "Hi, from my understanding, there are multiple dental AI companies," and there are a lot that you've never heard of that are continuing to grow and are doing amazing things. And there are, and you said Overjet, for example, is a very well-known company as well, and what sets Vidya Health apart from its competitors. And so I'll let Florian take what sets them apart for his competitors, but the team at Overjet's a great team. I mean, I've been working with them since they were in MIT in the think tank over there. And so I think there are kind of strategic decisions about different vendors. It's like a practice management software. There's some people that love EagleSoft. There's some people that love Open Dental. There's some people that are big fans of Dentrix. And so it's really figuring out what partnership works best, or what company that can service your needs makes sense the most. And there's lots of great companies that are out there. And so I'm not going to say that I really don't think there are any that are bad in this space. They do different things at different levels, and they have different goals, and they have different business cases and things like that. And so, but I think it's important for me is there are barometers that companies need to be able to meet in regards to FDA clearance. There's clinician feedback is a super important one. Patient feedback and experience is super important. And so I think as you look at tools in an office maybe you're in the future, or that you're looking at, if you have your own practice that you're looking to incorporate, it's important to find ones that fit in the workflow of what you do, because it's super hard to change, whether you've been practicing 30 years or you've been practicing 30 days. There really is to change and try new things. It takes buy-in and it takes commitment. Florian, so what sets Video Health apart from its competitors? Jeffrey asked. I know answers, but go for it.
Well, that depends what my audience is and how you think about it. But Jeffrey, it's a great question. I mean, I'm pretty happy that we have a lot of companies moving into dental AI, and so everyone gets educated. I did before in San Francisco cardiac AI, and we were the only company, and no one believed that this is important. So I think that was pretty good. I think it's like a high level 3 things for us in particular. I think if you really, at some point you graduate and you use the AI, use video AI versus, for instance, Overjet or any other platform, you will see that ours is just more intuitive and is a better product. It's not that we have done more marketing, to the contrary. Overjet probably did more marketing than us, but we invested everything in the product. And actually, I like what you were just saying, Seth, that you never want to be complacent as a dentist. And I think we never want to get complacent for our software. So we constantly improve our software to better workflows, to feedback. We have over 33 different FDA cleared detections. We have the first worldwide pediatric clearance. So we have a bunch of clearances which no one else has at this point. And so I would say it's the best product. I think number 2 is we have a pretty significant partnerships. One of which is a phenomenal partner, Henry Schein. As you may be familiar with, they own Dentrix and Ascend and all of that. And so our AI is directly embedded into that partnership and into that platform. So that makes our AI available without any extra click, right? Without any change management. And that's obviously very relevant, right? And that also contributes now. And Lisa, you asked this before, like the data and the feedback loop, right? That now we are, so to say, by far, like very far ahead when it comes to the number of locations which use us, the number of dentists who use us, the number of hygienists who use us daily. And again, we can incorporate that into the second aspect, right? And then the third thing is just, and Seth, you alluded to it without being too concrete, but every company focuses on different aspects. So for instance, Video Health, Videre comes from to see and to improve for better healthcare. I actually have been in your shoes. So I was in med school for 6 years. I dropped out. I was supposed to become a neurosurgeon. I founded my first company in Germany. That's my accent, in pregnant health, or like in women's health for pregnancy. And we built this company truly with the mission to support dental clinicians to provide better care to millions of people. And that's what we are focusing on, all our effort, all our funding we've raised, etc. And at this point, we always said no to insurance companies who wanted to use us for fraud, waste, and abuse. So we don't work, for instance, we do work with insurance companies in order to work, to streamline workflows and stuff, but we don't have contracts where we deny claims or anything like that. And that was just for us important. It feels a little bit like you need to decide a little bit on what side of the coin you want to be. And that's just a choice we made, right? And other companies made other choices and they have great reasons for it, right? So, but it's very different to Seth's point, right? You just have to see like what's most important. And then, Lisa, I'm looking a little bit for you here for guidance, but happy to take Martine's question as well, right? Martine asked, could you also talk about other applications of AI other than X-ray diagnosis? How could it help directly delivering procedures and design, etc.? So maybe I can give a first answer, and Seth, you can pitch in. And probably we should start doing presentations about this, Seth, too, because AI, if you think about the entire digital workflow of a dental office, is already or will definitely influence all of it. And so we are talking about the diagnosis. And I think what's happening is this will naturally propagate to automated treatment planning and documentation, right? I just want to make that's pretty clear. And to be honest with you, this is amazing news to you, because I was just this morning talking to a chief dental officer who says 20 locations which are still on paper copies, and it's crazy. They are just less productive because they have to do so much writing. And so I think you come actually at a great time, so to say. And I think then what we will be seeing is that AI will heavily influence, lab design, procedure designs, crown design, Invisalign, etc. And I think in multiple aspects of it. On the one side, identifying and doing the treatment planning for an implant, for aligners, etc. And then on the other side, also even in the production. So for instance, some of the aspects, there's a lot of point of care 3D printing research right now, where now aligners will do this much more accurate, AI will much more accurately help, so that the fitting or the rate of how good it fits, etc., increases, etc. So I think in the quality and in the treatment planning and in the delivery, it will help quite a lot. But I pass it to you also, Seth.
No, I think you hit on a lot of them. I mean, what we know is labs now are using AI in their design. I mean, they have for years. I mean, that's a lot of what CAD/CAM is. If you think back, it's computer vision. AI is a fancy word now, but whether it's machine learning or computer vision or other historical names of things, it's what we've found is over the years that obviously you hear about things like NVIDIA and their chip processing speed and new GPUs, and like the whole tech industry has changed. But really it's data, understanding data, how to use data and how to train models to learn from those subsets. So labs have been using it for years in design of cases. Align with Invisalign, they work on case planning. Their whole workflow has a ton of AI built into it. Scanners, I don't know how many of you are familiar with scanners and how much you're using. There's kind of AI-based principles in there about how it captures pictures and stitches them together. So whether, again, it's a machine learning process. But I think future state is we go to marketing things. There's going to be marketing becomes more and more accurate as, I mean, you click on things or say things, or I'm a big believer in privacy and data privacy. And so, but I mean, how many of us have been talking to a friend about, I don't know, wanting to go to see a sporting event or whatever, and then all of a sudden we're getting ads for tickets to said sporting event or music event or whatever it might be. And so I think from a marketing standpoint, you do have those things that AI will continue to influence, but and Florian talked about it too, is it just makes efficiencies within the business tools of the practice go smoother. Whether it's financing, helping somebody get financed at a more streamlined practice. How do you use AI and machine learning to impact the workflow of the practice? And again, it's my belief that if we can use that on an efficient manner, then we can spend more time's relationship with our patient, because it is a people business. And I really, really, really believe that care is about how we can connect with people. And so when we have the ability to create workflows that are more streamlined and systematic, that are more innovative, then it makes the experience better for the patient.
So
Great question.
How have your patients received AI as part of their diagnosis? Have they embraced it? Have they been skeptical? What kind of response?
So for the most part, you're always going to have those that are skeptics, and that think it's the Terminator, or have fear of anything that's related to AI. But we've had so many patients that have said, oh my gosh, I only want to go to an AI supported dentist, because they just know it's a built-in second opinion. It's a something that is not trying to sell them anything. It's just a non-emotional, non-biased, something that doesn't get tired. It never loses its accuracy. It just is consistent. And so from a patient standpoint, I think we haven't even touched on how it goes into case presentation and helps patients. And that's probably one of the most, I don't know, valuable components that I've seen with AI so far, is that to be able to show somebody their x-rays and show them in a way that they can understand what's going on in their x-ray. Like when I first started practice, we had film. And so we pour the film and it was like, we didn't even have digital x-rays. And so then we got digital x-rays and it was like, wow, we see so much more. And then you could put filters on digital x-rays and you're not on a view box anymore. And so you could almost hover over something and to try to show a patient a little bit more with their digital x-rays what's going on, but still patients would nod and say they see something on an x-ray when you're trying to say, oh, do you see this gray triangle area right here? And they say, yes, I see that. Or do you see this kind of bump on the back of your tooth? That's calculus and that's infection under your gums. And they say yes, but a lot of times they would say no. But to be able to put something in color and to outline where their cavity is or where the caries is, or really have a true measurement of how much bone loss is on the x-ray, that there's a radiographic bone loss measurement that the AAP says is necessary for diagnosing perio, and to be able to have an accurate number of that and have a patient who really understands their condition is super, super valuable. So the patients really like it because they understand more about what the doctor is saying to them. And way back when we started this conversation, I was talking about how no matter how accurate you are with your diagnosis, if you can't communicate appropriately and get patients to really understand what you're saying and really believe, like, and trust you, then it doesn't matter how well you diagnose. And I'm, again, such a big believer in clinical autonomy. Doctors are the ones that have the relationships with the patients, that are right there, chair to chair with them, knee to knee with them, that are looking at their case, that understand what's going on in their life, what's going on in their world that needs to be corrected or influenced, or is it a mother of 3 that is going through struggles at home and has to try to figure out how to get daycare to come in. And so, like, just how does dentistry affect the patient's life? And so you're in there with the patient and you understand them at a higher level, and you understand that a patient is way more than just what you see on an x-rays. And a doctor maintaining clinical autonomy to make decisions for patients is so important. And then the next step of that is diagnostic accuracy. And then the third step is communicate to a patient in a way that they understand what their needs are, so that they can say yes and fit it in their life and budget and all those kind of things. And so it's great if you're the best diagnostician, I don't even know if that's a word, in the world, and you just can't get a patient to say yes to the care that you need to provide them. And so this has really helped from a communication standpoint with patients to make things easier and better for them.
So I don't know if either of you can respond to this. It's probably the dental students who are listening in. At what kind of penetration does AI have into curriculum in dental schools?
Way too
So
little.
I'll let Florian take that, and then you want to piggyback on something I just said. So I'll let you go back to the kind of experience that way, and then go into the dental school thing.
Yeah, let me quickly. So let me go into the dental schools. Let me just before also comment what Seth said. I would just advise everyone go to a Heartland dental office. There are over 1,700 in the US, so I think you will find someone close by, and get your X-rays taken and see AI or see an AI. It is a really cool experience to see your own X-rays with FDA cleared AI on it. So in my company, we have a Google map, and you see like all the thousands of dental offices which use video AI, and everyone goes, like, our insurance, we make everyone like go to the zip code where they are and to experience themselves, so we understand how this feels like. And it is pretty incredible because I never had cavities in my life, so I thought. And I was just recently at the doctor. Now it's like already 3 months ago. But the amazing thing is that, first of all, I know exactly like what my bone levels are, right? Because we measure the bone loss, and if I have calculus, and honestly, this is the first time I started really flossing. I know it's terrible. Somehow in Europe we don't really floss, and that's actually a terrible thing. But like now I know actually that I have like here 2.2 millimeters, so that's good. But here I get like 2.9, 3.1. And so now I'm like, okay, this quadrant I'm flossing. And I actually want to go back to that dentist, right, to see how this works. And we actually working quite a lot right now on like, the different image qualities and angulations that this can be calculated out of different patient visits. And then the same with decay, right? You can see exactly where your decay is, and you can see if it's in the enamel, in the dentin, and the pulp. And then quite well, like, okay, well, if it's in the enamel, maybe I can still remineralize it. And there are more and more technologies to do that as well. Or if it's all the way into the pulp, oh God, fortunately, I didn't have that, but I really need to take something care of right away. And so it's a really powerful tool for the patient. I really can say so. To your question, Lisa, so we've been working with ATSU, for instance, in Arizona and so on for a long, long time. We actually had a product, Video Teach, where dentist students were able to compete against the AI and so on. It was really, really cool. And they were able to compete with each other and all of that. And so we've been working with a ton of dental schools. Our company is headquartered in Boston, right? And so we have like here three great dental schools. But I think it's still nascent. Like, I think it's still like I sometimes lecture. I have people in my company which lecture and all of that. But it's not really yet a kind of a curriculum fully. And I think that will change quite a lot in a not too distant future. Yeah.
And I would agree. I think dental schools are getting more and more innovative as time goes along. And I think it's just, we're not bleeding edge anymore. So it's cutting edge, I would say still. And so I think this is a good time for that to continue to build. And so we're seeing more AI adoption in dental schools. But again, I think it goes back to communicating it in a way that is accurate from a standpoint of what it does. And it's not taking the job of the dentist. It's not taking the clinical autonomy of the dentist. It really just goes back to making sure it's an assisting tool to help you really do things better for your patients.
So we've only got a couple of minutes left before if the students have any additional questions to round us out. And this may not be a fair question, but AI is still relatively new. You said it's not bleeding edge anymore, and I get that, but I think where we are now and where it's going is fun to think about. Can each of you just take a minute to talk about your vision for the future?
Yeah, absolutely. But I want you to go first. That's my favorite question, Lisa. So,
So I've seen some really amazing things that are being worked on, not just with Video Health. I mean, I have a number of NDAs with various companies, non-disclosure agreements, that the future, I will say, is bright for dentistry as it relates to technology. What's super exciting too is that the companies that I'm getting to work with on new innovations and technology in this space are really willing to listen to the opinion that doctor autonomy is first and foremost a critical component to what we do. And so that we are a relationship business. And so it's super exciting to see some of the things that are coming down the lane to make efficiencies. I will say you will see automated chart nodes in a near future. I'm trying to think of things that are that I don't have NDAs on that I can speak to. Continue to see improvements in scanner technologies and workflows and billing of practices and practice management system improvements. So on top of the on the radiology side, I mean, there's a future case, and I should have talked about it earlier, but where CBCTs will be utilized for implant placement, and I mean, vendors will direct ship you the right implant that fits in that case and send you a surgical guide for that implant to make sure it goes in the right position at the right angulation on the bone, depending for the patient. There comes a future state where there's even a greater correlation of predictive care. So where for you, Lisa, based on the medicines you're on and based on age, wear patterns, other things, that you can almost pick materials to last longer. And so my belief is that we'll continue to see such progress in dentistry that we can catch things earlier from a disease window standpoint, and we can look at things like Curodont, which is a regenerative kind of peptide matrix that's a biomimetic solution that will help remineralize incipient lesions. And so we can get to the point where we can start the disease process late. And those are things that I get super excited about. So sorry, Florian, that was a long answer for things that I get excited about the future. And I know you do too.
Yeah, absolutely. I mean, I think about the future kind of in three horizons. We mentioned three horizons of video health. And I'm not saying we will do all of those. As Seth was saying, this is a very cool ecosystem with great companies. But I do believe that in the next 3 years, AI-powered diagnosis and treatment planning as a supportive tool will become to some extent the standard of care, which I mean that the large majority of dental clinicians as well as patients, we will diagnose and treatment plan with AI. I think then the next step is all about automation, and this is some of it is happening in parallel and stuff, right? But I do think the next step is then everything around automation, where it comes about documentation automation, not just chart notes, claims, payments, all these workflows, which I truly do believe that the first horizon is like, it enables better care. The second horizon, I believe, enables, so to say, more patient-facing time, what everyone enjoys doing, and less time in the back office, right? Doing repetitive tasks, which I hated that when I was doing my internships. And then I do believe that the third horizon, which will take a bunch of time, but that is something people underestimate. If you have billions of databases, what you can do is that you do something like medical dental integration. And coming myself from healthcare and going into dentistry, I'm pretty excited about it. And what I mean by that is I do believe we can, with large data sets and also partnerships with other healthcare providers, find, for instance, predictive analytics about flagging at the dentist care side, potential disease or first signs of hypertension, diabetes, etc. And that would be incredibly exciting because a lot of patients go regular to the dentist because it's cosmetic and because it's cheap and fine, compared to going to the primary care physician, getting checkups on hypertension. And it's one of the biggest cost drivers in the United States, by the way. So interestingly, on $1 of the trillions of dollars we spent on healthcare in the US, 4 cents are spent on dentistry, 96 cents are spent on, general healthcare. And if you look at the 96 cents and you take out cancer, which is a huge benefit, like a huge contributor to this, hypertension and diabetes, so these chronic diseases are the next in line, really, as huge contributors. And I do believe that we can catch that earlier, and also dentistry will have an impact on overall health. And I'm very excited about it. And those are the things what AI actually can do, which is hard to do otherwise.
Well, I love that.
And I'm so
moving to
glad you
medical
touched on that.
dental.
Sorry, Lisa. I'm so glad you touched on that because that's where I was hoping you were going to go. Because then I was going to piggyback on that, like just what the future will hold in regards to diagnostic for dentistry as it relates to full body disease is going to be phenomenal. And whether it's tests to, again, catch biomarkers for early cancer detection, early intervention related to hypertension, to cardiac disease, all those things, like that's where the future state is going to be. And is it wearable chip in, something that's inserted in your mouth that's checking for not only acidity, but also looking for different biomarkers that are there. There's some really neat stuff that's coming down the line. So I know we've got only a couple minutes left.
And I do want to quickly answer Shivani Shah. Do you have recommendations when to learn more about core concepts of AI, etc.? Well, there are a couple of cool blog posts. One is by Wade Why, for instance, and so on, who explain this really easily. And then if you want to go a little bit more hardcore, then there's MIT 101. You can Google it. It's actually a class I had to take as well. MIT 101. It is a public class on AI, and I think that's a really good introduction. I don't know how they called it anymore, to be honest. I just Googled MIT free introduction to AI machine learning. I think that's how they called it.
They also, it's
they're
funny
pretty
you
great.
mentioned that. I have one right here that's an MIT, and it implications for business strategy. It's an online short course. So MIT does have a different number ones. That's actually one that I was playing with recently.
Yeah, exactly.
6-week
But
study.
they are pretty good. But that's maybe pretty rigorous. But yeah.
So it just depends on how far in the weeds you want to get.
Exactly. That's why I mean, like I was just as I was suggesting, as I was like, I don't know.
Well, I want to thank both of you for being on. It's an exciting conversation, and I was thrilled that you both brought up the medical dental integration part, because I think dentists are now coming into their own as an extremely important healthcare provider, and it's good that you're being recognized as such. So I love that. Love the application of AI into earlier diagnosis and treatment, and really helping people beat the disease before it starts. So, I have this urge to go see my dentist, but maybe I'll hold off because I was just there last month. But thank you both, Dr. Gibri, obviously from Heartland, and Florian from Vidya Health. It was terrific having a chance to be part of your conversation.
And thank you for having us. I appreciate everyone taking the time on a Tuesday evening, and thank you for coming to listen to us. If you need anything and want to reach out, I'm more than happy to engage. You can find me either on LinkedIn is probably an easy way to get hold of me. But if you want to reach out, I'm more than happy to engage. And then I think we also have some other people that maybe visit your school or whatever. But I'm more than happy to assist however I can. You're in an exciting profession. It's an exciting time. So thank you for having us.
Absolutely.
Florian.
Yeah, thank you everyone. Thank you, Lisa. Thank you, the team. Thank you so much. And everyone, if you want to learn more, please reach out as well on my LinkedIn, ideally, or through this code. I know it will be really exciting. We are doing more and more projects with dental schools. And to your point, Seth, I want to leave it actually with this. I was 10 years in healthcare and AI, and I truly believe that in the next 5 years, we will be 10 years ahead of healthcare and dentistry. And so it's very exciting.
Well, on
Thank you.
behalf of ASDA, we want to thank you for participating in the webinar, and thank you to the Association of Dental Support Organizations for your continued support of our members and our mission. For additional information or to request a visit from Heartland Dental, please scan the QR code on your screen. If you'd like to view this webinar again, it will be posted in 1 week on ASDA's YouTube channel. Thank you all again, and you have a wonderful evening.
Night, everybody.
Bye-bye.